Hi, I'm Bob Beckwith. I'm the Infrastructure Manager for Newcastle Hospitals. We've used video for a number of years. It came about from the Northern Cancer Networks. They had an initiative to put it across the region, and we ended up with a number of installations, predominantly at the Freeman Hospital. So we've progressed that use over time. There was a few challenges with the initial installation. They were all local installs. They had ISDN gateways in the rooms. Management was very labour intensive. Couldn't really do a lot more than point-to-point calls. But overall, it did what it needed to do. Very small number, handful, 5 or 6 systems across the whole organisation. And it did what it needed to do. And that was about it. So a few years before the pandemic hit and video collaboration skyrocketed, we identified the requirement to have video throughout the organisation. We're very large. We've got 2 main sites, got 14,000 employees. So it didn't take long before those requests were coming in to use video for more than the systems we had installed. We looked at a number of options to facilitate this requirement, and it was quite obvious that a cloud solution was the only way forward. These individual installations in rooms just were not sustainable. So we reached out. Prodec helped us, proof of concepts, introducing us to manufacturers, numerous demos, and we settled on a Starleaf system. We're early adopters of Starleaf, I think, in terms of the NHS, and it was a huge success. We rolled out a number of systems. MDTs were involved. People had the ability to purchase systems at relatively low cost and install them in their departments rather than having to book rooms out all the time and wait in a queue before space was available. And also we rolled out the client. So for the first time in the trust, we had desktop-enabled video conferencing, video collaboration. And again, that was a huge success. A lot of people straight away saw the benefit of not having to travel across sites, the benefit of talking to colleagues outside the trust. And overall, the feedback was very good. Pandemic hit. We were in the fortunate position to have a cloud-based solution installed and proven and widely adopted. What happened almost overnight was the demand went through the roof. So people instantly wanted the ability to communicate when they weren't on the site or face-to-face. Some of them have become very used to now, but at the time we weren't. And the cloud-based solution was ideal for that. We weren't prescriptive on what devices people needed to use. It would work on any device they could get their hands on. And at the time, it was any option was available to them. So personal devices, trust-owned devices, devices that would VPN back into the trust, devices that wouldn't. Whatever was available, that service could be installed and ran from it. And we had seen, I think I'd have to look at the stats to get the exact figures, but a 5-fold increase in the number of people using it for messaging and for video. They weren't just clinical staff. It was a huge bonus to have the tool available for administrative staff as well, just to keep in touch, team meetings, etc., share documents. But in terms of delivering our core service, a clinical service, the tool was used a lot in the ability to bring the specialists together, kind of an MDT, but more of a remote MDT. So in the past, where you would have had traditionally people in the room and a far end brought in, so 2 groups of people talking together over video, we moved from that to individuals joining in from individual devices to form a group. And the cloud technology really let business continue when the pandemic hit. Introduction of Office 365 and the licensing agreement between Microsoft and the NHS, that we as an NHS trust had the option to buy into that, which we did. So we purchased the Office 365 licenses and we became part of a shared tenant. With that came the ability to use Teams. So again, a cloud-based collaboration, video, IM platform. And that followed on very nicely into the adoption of our previous cloud-based solution, Starleaf, because our users, our staff, were already familiar with using video. The tool, in some respects, was irrespective. They had the cameras, they had the microphones, they had the headsets, they had the stigma of talking to a screen had gone. It became natural. So introducing Teams was relatively straightforward from a user adoption point of view, and also not a difficult task from an IT point of view either. So that big jump in usage of collaboration tools in Starleaf and the cloud service continued once we'd signed up to Teams. And as we all know now in the NHS, Teams is very popular. It's arguably the tool of choice when it comes to collaboration. And then all of a sudden, people could then IM others in the NHS. They could share documents and work collaboratively with others that were using the same tools. And Prodec helped us deliver the upgrades, or replacing Starleaf equipment with Teams equipment throughout the trust. And the number of systems we have is continuing to grow to this date, with a slight shift, I would say, in the way people are using the technology. With the agile working and the home working, people became used to using their own device, even if it was to talk to colleagues that they were previously gone into a physical room to talk to. And it's quite ironic sometimes in the office, you'll see 3 people using Teams to talk to each other, sat next to each other on video. And I think that's just people have become so used to using the technology. One Saturday morning, I received a call from my director to say, "Can you meet me at a warehouse in Sunderland?" Not the usual phone call you receive on a Saturday morning. So I turned up, and there was about 4 of my colleagues and my director stood in a very large empty warehouse. I'll be honest, I wasn't sure what was going on, but quite quickly it unfolded that this warehouse was required to be a hospital as soon as possible in a number of months, weeks. So once we all got over the shock, we all given our tasks. Myself working in IT was asked to deliver connectivity, telephony, video conferencing, PCs, printing, patient Wi-Fi. The list was quite long. So challenge accepted. Off I went to sit in a quiet corner to contemplate it. And one of the first calls I made was to Prodec. So I discussed with the account manager at the time what the requirements were. Once we both accepted the challenge, I guess, we got onto it. So there was no questions asked that it was a Saturday. We'll work the Sunday. It never really came into the conversation the day of the week it was. We just got on and started to look at what was needed. We had a number of calls with the wider Prodec team who had never met the telephony side before, but good guys, had a chat with those. Quickly developed a technical solution for all the deliverables we asked for. And I would say within a week or less, maybe 4 working days, we were quite clear on what was needed, quite clear what Prodec could deliver, idea of costs and when they could deliver it. So that was fed very quickly back into the project. And then quite literally the troops arrived because the army helped us with this build. The Prodec turned up, we delivered the services, we tested them. And in the end, I was personally quite proud of what we achieved. The building turned into a fully fledged hospital. It had everything from wards to the admin areas to mortuaries, cafeterias, receptions, change areas, everything you'd expect to see in a hospital that would maybe take 3-4 years to build. In terms of the technology, we made the conscious decision to keep it as standard as possible for obvious reasons. So video conferencing was installed. We expanded our telephony system into the building and incorporated a deck system so the staff could use it on the ward areas. And it's been recognised nationally what a good job was done. So it's something I would certainly remember as part of my career, and I would thank Prodec for the help with it. The trust relationship with Prodec is 3 or 4 years old now, and I think we're now at the point where that trust has been built up between us. Certainly, they are my go-to person when something lands on my desk that needs to be delivered. Hopefully not as quickly as the Nightingales, but in normal timescales. And one of the benefits, or there's a number of benefits, but I'd say one of the things that stands out with Prodec is their ability and their willingness to let us test things, proof of concepts. Some things work, some things don't. Some things are very expensive to buy. Prodec can provide those for us. We can put them in real life rooms, in real life situations, and give them a test. And I think Prodec's relationship with the industry has also helped with that, because quite often IT guys will suggest a certain way and Prodec will try and steer us down another way because we're not all experts. And overall, the end result is something that works because we've tested it, which is great, but also we're not wasting time on looking at technologies that really that aren't fit for purpose, that we may have done without having someone like Prodec to go to first.